name is Jackie Wise, and I chose coronary artery disease to present to you today. The reason I chose coronary artery disease is that I'm a nurse, and I work in a acute medicine unit as well as in the emergency department. And coronary artery disease is very prevalent within our practice. So an overview on coronary artery disease. Coronary artery disease, or CAD, is one of the most prevalent cardiovascular disease amongst men and women in both Canada and the United States. It occurs when there is a disruption of blood flow within the blood vessels in the myocardium, or the heart. So because of the impeded blood flow, nutrients and oxygen can't get to the heart muscle. And this causes cardiovascular disease and coronary artery spasm within the heart. So plaques accumulate within the vessels. We call that arterial sclerosis. And because those plaques accumulate, the body then will send out an inflammatory response. So that's our own body's way of trying to heal whatever the issue is. And that only impedes the blood flow further and causes extra heart muscle to die within there. As these risk factors continue, platelets are sent out in that inflammatory response. With the accumulation of platelets, or the platelet aggregation as we would call it in practice, that puts us at higher risk for other things like heart attack and stroke. Because what happens is, as the blood flow is impeded, there's more platelets accumulation. The blood flow stays stagnant and then will clot within the vessel. If the clots break off and go to any smaller vessels, that increases our risk for cardiovascular disease as well as a history of heart attack. We're not really sure of etiology, but what we do know is there's risk factors involved with coronary artery disease, and we can have modifiable or non-modifiable risk factors. Non-modifiable risk factors are things that we really can't avoid, such as age, gender, family history, or ethnic background. In our profession as nurses, what we really focus on are the modifiable risk factors. Modifiable risk factors are things that we become habit to or accustomed to, but we can change and will decrease coronary artery risk significantly. And those things are like stopping smoking, decrease in weight, a decrease in stress, more physical activity, and a better diet, low in fats. So this is just a illustration of how these plaques accumulate. Here in the vessel, these yellow areas, that is the accumulation of plaques. We have the accumulation of plaques, then we have the inflammatory response, where platelets then aggregate within the area. They will develop a clot. As you can see here, this is where the clot's formated. And you have the decrease in the blood flow there and causing a decrease in oxygen. This is an illustration of arteries. This is a good artery to a completely occluded artery. You can see the plaques accumulating at the sides. After the plaques have accumulated and occluded the vessel completely, there is no oxygen flow past that area. What does that lead to? Well, coronary artery disease can lead to other disease processes such as hypertension or high blood pressure. And this occurs when there's a decrease in the vessels and more restriction in blood, which increases the pressure within the system. Pain, which we call angina pain, which is due to the decrease of oxygen within the heart tissue, as well as congestive heart failure, or CHF. That's because the pump of the heart isn't working properly. There's no pumping action, so we have an increase of fluid, which will lead to CHF. And then myocardial infarction or death may occur as well if it's completely occluded. Signs and symptoms that occur when there is inadequate blood flow to the heart are things like fatigue. You can't finish your daily activities, as well as chest pain due to the decrease of oxygen. SOB, which is shortness of breath, again to do with the oxygen level in the body. Syncope, which is just a fancy way of saying dizziness or passing out. And then the increased cough especially in congestive heart failure occurs at that point. Diagnostic testing. These are things that we're going to do when you present to us within our facility. EKG, we'll run an EKG to figure out the rate and rhythm of your heart, to see if there's any abnormalities in that, as well as a stress test. Stress tests will be completed to see the oxygen demand of the heart. Blood lipids will be drawn to see what your cholesterol level is and if we can decrease any lipids within the body with medication. And then we might have to do cardiac catheterization, which we'll talk about briefly on another slide. So our treatment goals are, of course, to decrease the plaques within the vessels, and that's done with exercise and diet, as well as some medication may be needed here as well. And this is just another diagram of plaque accumulations, the inflammatory response and platelet aggregation, and then the clot forming here within that vessel. Medical treatment. Medications that we'll give you when you first present are things called nitrates. Those nitrates vasodilate. So if there's an occlusion in the vessel, it can dilate that vessel and allow blood flow around whatever is accumulated. And we'll give that first to try to get blood flow to the affected area. Then we go to calcium channel blockers. It's a cardiac medication that allows the heart muscle to contract better, or control contractility. It increases cardio output to the rest of the body. Beta blockers, they'll decrease pressure and decrease rate, which then again will decrease the demand on the heart. And then anti-lipids again for the lipid aggregation. This is the catheterization we talked about in the two previous slides before. The percutaneous translumen coronary angioplasty, and it's just a nice big long word to say that the surgeon goes in, he goes with a catheterization in through one of the major vessels and has a look within the heart vessels. If there's any damage to the vessels, he'll do one of two things, or maybe both things depending. A dilation of the narrowing. If the vessel's in good repair, he'll just go in, he'll dilate, take out some of those lipids, and that heart muscle will be fine. If the vessel's in poor repair, they'll stent it. So stenting is when they put in a metal, almost like a spring, into the vessel. It just holds the vessel open and allows the blood flow to go through that area. If all of those things don't fare well, medication and then the catheterization, then you'll go into a coronary artery bypass. This is where people say they've had open heart surgery. So what happens is they take a good vessel from the body, they connect it to the heart where there's good blood flow, and they bypass the area where there's poor blood flow, so the blood flow then goes into the heart muscle where it's needed. So these are the two occlusions here, and you can see in this diagram where they've bypassed those. Nice healthy tissue now, good oxygen flow to the heart. So nursing considerations and what we need to think about when we're looking at somebody that presents with coronary artery disease is health promotion. We want to talk about modifiable risks, making sure that we're educating and providing disease prevention, and telling them the services that are in place for healthy eating, dietary needs, any exercise, hypertensive clinics, anything like that needs to be presented with these people to decrease their risks of coronary artery disease. So that concludes my presentation. I hope it was very informative, and I thank you very much for watching the video.